the part silence is the cue to start. So good afternoon, ladies and gentlemen. It's fantastic to see so many of you here. My name is Mai Krishnasamy. I'm the Chair in Cancer Nursing at the University of Melbourne and the Research and Education Lead for Cancer Nursing for the Victorian Comprehensive Cancer Centre. I'd like to start by acknowledging the traditional owners of the land, the Wurundjeri people of the Kulin Nation, and pay my respects to their elders, past, present and future. It's just fabulous to welcome you here, and also the 145 people who are online, which is a remarkable turnout, and I think a real testament to the topic that we're going to hear about today. I think the engagement that we have is absolutely characteristic of everything we hope the Victorian Comprehensive Cancer Centre would be. It's an alliance of 10 partners, clinical organisations, research institutes, the University of Melbourne, and of course all those people who are partners and collaborators with the 10 alliance partners. It is an opportunity for us all to come together across research, clinical care, education, to really think about how we partner from acute centres, primary care and out into the community to really reduce the burden of cancer for the Victorian population, but also for Australians, wherever they may be. So a very, very warm welcome to you. It's a particular pleasure to be chairing this session. I was asked by Associate Professor Prue Cormie probably about a year and a half ago, Prue, if I would be interested in being involved as a project member on the ExMed Cancer Programme, and I was delighted, and it took me about 3 milliseconds to agree to take part. I think it's hard for any of us to look in newspapers or pick up a journal without seeing some reference now to the importance and the relevance of exercise in the context of cancer treatment, not just during treatment, but helping people be as well as possible before they start. And critically importantly, keeping people really well as they get to the end of treatment and on, hopefully, into long-term survivorship. But even for those people, perhaps, whose longevity after they finish treatment isn't as long as they would hope, the benefits of exercise, we know, speak enormously to quality of life, to the impact on symptoms and symptomatology, as well as the evidence, the increasing evidence that we're seeing that exercise during cancer can prevent or prolong how well people are before a recurrence, and for some people even has a prognostic impact in terms of the efficacy of their therapy. There's a lot more work to do, and part of that work is the ExMed Cancer Programme. It is an opportunity for all of us, whether we're clinicians, researchers, educators, but very importantly, patients, families and friends, to ask about and recommend exercise for people when they have a diagnosis of cancer. We all know how important it is for us for well-being, irrespective of whether we have a medical diagnosis or not. We also know from the evidence that few of us actually meet the requirements for exercise, whether we deem ourselves well or whether we have a diagnosis of cancer. And so today is an opportunity to hear about a really exciting and innovative programme that will make exercise accessible to people out in the community with expertly trained exercise physiologists who are specialists in working with people with cancer and people who have completed treatment for cancer. And really what we want is a vibrant discussion. We've got 4 great speakers, and I'll introduce them one after the other. And at the end, we'll have a panel discussion with an opportunity for you all to ask the questions that you may have of the group. But I'm going to stop talking, and I'm going to introduce Associate Professor Prue Cormie. I've got a very formal introduction, so I don't forget anything, Prue. There's a lot to say. But Prue, for those of you who know her, is an accredited exercise physiologist and researcher whose work really focuses on looking at the benefits of exercise for people across a range of diagnoses and at many stages of their illness and on into their survivorship. Her real focus is enhancing the lives of people, whether they are on treatment or completion of treatment, or indeed before they start their treatment. She is an internationally recognized leader in her field. If you've seen her TED Talks, I really recommend you have a look. They're really engaging and motivating. She's got over 70 publications in scientific journals. She's presented at over 200 conferences nationally and internationally. So we're really in for a treat today. It's my delight, Prue, to welcome you to talk to us.
Thank you very much for the very warm welcome, Mai. It is my absolute pleasure to be here today and to be representing the ExMed Cancer team. This project is about developing, evaluating, and implementing an exercise service that really allows for exercise to be embedded in as a standard component of cancer care. This is what ExMed Cancer is, a best practice exercise medicine program for people with cancer. Now, the overarching aim of this program is to make meaningful improvements in the lives of people with cancer through effective and accessible exercise medicine. ExMed Cancer has been made possible through funding from the Victorian Department of Health and through their Victorian Cancer Survivorship Program. I'd really like to acknowledge and thank the government for investing in this initiative. So as Mai said, we've got a great panel of speakers today, and my job is really to represent the ExMed Cancer team and provide a bit of an overview around what is ExMed Cancer. So I wanted to start with talking a little bit about why we need ExMed Cancer, and then talk about what specifically ExMed Cancer is and how we can all become involved in ExMed Cancer. So let's start with the why. What is the rationale behind developing ExMed Cancer, and why do we need it? Well, I'm sure many people in this room know that cancer is a devastating disease, and for many people it can significantly compromise their health and well-being. And we know that every 4 minutes an Australian is diagnosed with cancer, and unfortunately every 11 minutes someone dies from cancer. Now, the stats indicate that half the people in this room will be diagnosed with cancer at some stage of their life. Now, there's good news in that, the sense that we have a lot of very effective treatments that can help slow the progression of cancer and extend life quite meaningfully. The bad news with that is that these treatments are also associated with significant side effects that for some people can really impact quality of life and their ability to lead a normal everyday life. And what we know from a wealth of observational and clinical trial research is that exercise is a very effective medicine to help manage and prevent these side effects. And in fact, based on what we currently know, exercise is the best medicine someone with cancer can take, in addition to their standard cancer therapies. And that's because people who take their exercise medicine regularly have a lower relative risk of dying from their cancer. They experience fewer and less severe side effects. And they also have a lower relative risk of their cancer reoccurring. We know from a significant body of research that if the effects of exercise could be encapsulated in a pill, it would be prescribed to every single person with cancer. And even if that pill had just a fraction of the positive health benefits that regular exercise provides, it would be viewed as a breakthrough in the fight against cancer. Now, unfortunately, most people with cancer aren't performing exercise, but the level of evidence that we now have available mandates that exercise should be incorporated as a standard component of cancer care and be prescribed alongside surgical, chemotherapy, and radiation treatments. This isn't just me standing up here saying this. This is international organisations endorsing exercise as a standard component of cancer care. Here in Australia, the Clinical Oncology Society of Australia, the peak professional body representing all health professionals involved with the care of people with cancer, will in just a couple of weeks release a position statement that says just this, that exercise needs to be viewed as an adjunct therapy for the management of cancer, and that all people with cancer should be prescribed exercise and recommended to achieve the exercise guidelines that are evidence-based. And for best practice care to include referral to an exercise physiologist or specialist who has specific expertise in working with cancer patients. So why do we need ExMed Cancer? We need ExMed Cancer to fill that exercise prescription. ExMed Cancer does this for patients. It facilitates the ability of adhering with evidence-based guidelines. It allows health professionals a safe and effective evidence-based program that they can simply and quickly refer their patients to. Now, international guidelines state that these are the exercise guidelines that people should be working towards to achieve significant health benefits. So 150 minutes of moderate intensity aerobic exercise and 2 to 3 resistance exercise sessions each week. Now, they're funny kind of numbers, but basically what this equates to is a 30-minute brisk walk on 5 days a week. And heading into the gym or performing weight-bearing activities against resistance at a moderate intensity 2 to 3 times a week, about 45-minute sessions. Now, the key element to realising the therapeutic effects of exercise or providing significant health benefit is that it's the right type of exercise. We know from a significant body of research that the higher quality exercise somebody does, the more pronounced benefit they gain for their health, their physical and mental well-being. So moderate intensity is very key to do this. And for people with cancer, we know that exercise is particularly good for people with cancer. To maximise those benefits and to realise that effect as a medicine, this needs to be individually tailored and prescribed. And this is what ExMed Cancer does. So what is ExMed Cancer? What is the program and what specifically does it involve? Well, as I mentioned before, it's a best practice exercise medicine program, and it allows patients to realise these evidence-based guidelines. It provides the health professional with a safe, effective and feasible service that patients can easily access close to their home and in a way that can facilitate ongoing exercise for a long term. And really importantly, this is a non-for-profit health service. This is a health service that we want to provide easy access to patients regardless of their financial situation. Now, ExMed Cancer has been led by the exercise oncology team at Australian Catholic University, but we draw on the outstanding expertise and experiences of a broad range of stakeholders. And we have significant partnerships with each of the organisations listed here. Some pioneering hospitals, some fantastic integrated cancer services. We're working with the primary health networks to communicate to general practice practitioners. We've got excellent academics to really make sure that there's a lot of scientific rigor around what we're doing with the evaluation. And then we're also tapping into community-based networks and the expertise of delivering public health and widespread health services. Oh, well, we have 101 webinar attendees, sorry. But we also tap into Cancer Council Victoria, Breast Cancer Network Australia, Prostate Cancer Foundation Australia to really extend the reach of ExMed Cancer. So I have to acknowledge the overwhelming contribution from each of these organisations and thank them for being a part of ExMed Cancer. So what specifically is ExMed Cancer and what can a person with cancer experience when they're referred to ExMed Cancer? It starts with a referral, and that referral can come from anybody in the multidisciplinary cancer team. It can come from the patient themselves. It can come from anybody in a member of their support network, a community-based organisation, and it's very simple and easy to do that. That referral pushes people into what we call the ExMed Cancer Hub, and this is really an information source which allows us to coordinate the care from acute settings, from the specialist that refers the patient from hospital through general practice into allied health in the community through exercise physiologists. So we talk to the patients, we provide them with an information pack around what ExMed Cancer is and resources in terms of accessing their general practitioner. We send them on to a GP and ask some specific questions around their health so we can make sure that the exercise intervention is specifically prescribed for that person. We also then enable the patient to access some Medicare benefits and allow this to be an affordable health service for them. The GP then refers on to an exercise physiologist who is upskilled and trained to work in ExMed Cancer. And they have a one-on-one consultation, a conversation with an expert around exercise. And this allows for that prescription to be specifically tailored and individualised. In order to teach people how to do that exercise intervention, we have a one-on-one session between the patient and the exercise physiologist. We go through the practicalities of their exercise prescription. And then this is followed by 3 months of an exercise program that's delivered in a group-based setting 3 times a week. Once they've finished that intervention, they have another chat with their exercise physiologist. And that's all about coming up with a plan for what's next and making sure that that plan for what next is specific to each one of those individuals. And the intention of that is to really facilitate ongoing self-management, the ability to continue to exercise after ExMed Cancer has finished. So this is what the pathway of a patient involved in ExMed Cancer will go through. It's coordinated all the way through what we call the ExMed Cancer Hub. Now this hub involves a whole range of resources and information, and we disseminate that through a website that's available for everyone to view, a phone line that you can tap into expertise from an exercise physiology perspective. It also allows us to coordinate the care between the hospitals, the GP, the exercise physiologist and the patient themselves. The hub also incorporates an education component. So we have education that allows for people to understand exactly why they should be exercising, allows health professionals to know what an exercise physiologist is and what specifically ExMed Cancer is. It also allows us to coordinate the reporting between each of those health professionals involved in the patient's care. And access for healthcare professionals to ask advice and to seek information around how we can individualise those programs and maximise outcomes for patients. So once people go through the hub and into the actual exercise prescription, what are we getting them to do? Well, the sessions involve moderate to high intensity aerobic and resistance exercise, and this is in line with the international guidelines for people with cancer. We deliver it over 3 group-based sessions each week, and those sessions last about 60 minutes at each of those times. Now it seems like a lot to try and commit to, but we know that this is a really important level or dosage of exercise medicine that allows for significant health benefits. And specifically, the prescription is individualised. So it's very tailored in terms of the type of cancer someone has, what stage they've been diagnosed with, what kind of treatments they've experienced, and what are the side effects and symptoms they may be experiencing from that. And of course, their general health history. So in order to do that, we need people who have specialised expertise to deliver the exercise. And that's exercise physiologists. Now, exercise physiologists are like GPs, if you like. So they're the GPs of delivering exercise. They're specifically trained through university and ongoing professional development to deliver exercise to patients. So they have a very firm focus on understanding what happens to the body when we exercise and how a disease and a disease's treatment interacts with those changes in our body. Now, the people delivering ExMed Cancer will go through specific professional development, allowing them to really hone into exactly what needs to be done to maximise benefits for people with cancer. And they also then have access to through the ExMed Cancer Hub to experts in the field to be able to ask very specific questions about potentially high-risk patients. So where is ExMed Cancer delivered? It's delivered across 5 sites spread out throughout metropolitan Melbourne. And these sites allow us to implement ExMed Cancer to 200 patients over the next 18 months. These sites are spread out in terms of being able to distribute and get people accessing their health facilities, their fitness centres without requiring too much travel. And we have great partnerships with these community-based fitness centres who've very generously discounted memberships and allowed us to really deliver ExMed Cancer in a cost-effective way. So Melbourne Studio Gym in Fitzroy in the city, Coburg Leisure Centre, Hawthorn Leisure Centre, Monash Sport and Fitness out at Caulfield, and also Sunshine Leisure Centre as well. So who is ExMed Cancer for? what kind of patients can we deliver it to? I think overwhelmingly the message is that ExMed Cancer is for all people with cancer. At this stage, we are funding for 200 patients, so we need to be a little bit selective in who we can provide these positions for. Long term, we want to be able to provide access to as many people with cancer as possible. So at this stage, anybody who has a diagnosis of cancer is eligible to participate in ExMed Cancer and to receive a subsidised exercise service, so it's free for these patients. They have to have completed cancer treatment and be within 1 year of completing cancer treatment. Now again, the ExMed Cancer is developed so that everyone can be involved. We have to only apply these restrictions because we've got a set amount of funding that we need to try and make sure that we're getting patients who have the highest amount of need to access these services initially. Now, the education component of ExMed Cancer is really important in terms of understanding beyond just the fact that exercise is good for everyone, but having a really fine-out understanding of exactly why exercise is important for people with cancer and what kind of exercise needs to be done, how it needs to be done, and what's the scientific evidence backing that up. So we've developed very targeted education components for the multidisciplinary cancer team, for general practitioners and nurses within the GPs settings, exercise specialists, as well as people with cancer and their support network. In addition to this, we want to make sure that we're always refining ExMed Cancer. We want it to be the best possible health service that we can provide. So we incorporate an evaluation framework. Now this evaluation framework is very focused on making sure that we make ExMed Cancer as accessible as possible. We also need to have it underpinned by evidence to make sure that it's effective, and not just effective in terms of generating health benefits, but cost effective. So we can really push towards scaling this up and delivering it nationally. We're very focused on trying to have a sustainable health service, something that can continue to run long term, and that it can be transferred to other different settings in terms of earlier in the cancer treatment trajectory. So what we're working towards is really having the ability of ExMed Cancer to make a meaningful difference to people's lives, and being able to develop a model of care that is sustainable and scalable, something that we can incorporate as a standard component of routine care, and something that we can scale up and run nationally so that we're able to get more people involved with high quality exercise medicine. So finally, I just wanted to touch on some elements about how you and everybody can be involved with ExMed Cancer. And I'd certainly encourage you guys to access many of the resources that are outside in the lobby to try and facilitate some of these engagement opportunities. The first thing you can do is, if you're a health professional, just to refer your patients to ExMed Cancer. We've tried to make this as simple and as quick as possible. You can online, you can tap into the website and fill in your patient's name and contact details, and they'll get a call from an accredited exercise physiologist who's upskilled to talk to patients. You can phone in and provide those details, or you can send us an email. We have a lot of resources that allow you to remember to do this and to facilitate those referrals. Posters, flyers, stickers that you can pop on your clothes every day. It's not just limited to the health professionals. Anybody can enroll in ExMed Cancer. If you're a person who's been diagnosed with cancer, if you're a family member, if you're a member of the community who's trying to help out. And the same ways, you can jump on the website, you can give us a call or send us an email. And again, we have a lot of ways that we can really help facilitate those referrals. Another thing you can do is talk about ExMed Cancer and the role of exercise in cancer care. Again, there's a bunch of resources. We have posters, we have a whole suite of resources that we'd more than happily provide you to help get the message out there and spread the word about the role of exercise for people with cancer. And there's also the potential to fundraise for ExMed Cancer. We've been so fortunate in the sense that we've been funded for 200 patients, but our vision is large. We want to provide these services to as many patients as possible. We want to expand throughout regional areas of Melbourne and also more metropolitan areas. We want to be able to sustain the hub so that we can have more reach and try and help people, not just in a face-to-face perspective, but also what we can do from a distance-based perspective. And then we want to try and roll this out nationally, provide best practice exercise medicine to all people diagnosed with cancer. Hopefully, a few years down the track, we'll have this kind of outcome where we have established ExMed cancer sites delivered throughout Australia with the ability to then enhance people's lives through high-quality exercise medicine. So thank you very much. I'm really looking forward to discussing ExMed Cancer with many of you here today. So please feel free to reach out if you have any questions or if there's anything that we can do to help support deliver ExMed Cancer to your patients or to your community. So thank you very much.
Thank you very much, Prue. I'm sure there'll be lots of questions afterwards. It's now my real pleasure to introduce you to Mr. Vin Jenkins. Mr. Jenkins was diagnosed with prostate cancer in 2008. He's an ambassador for Prostate Cancer Foundation Australia and is a consumer representative for the Peter MacCallum Cancer Foundation. He's also a member of the exercise oncology team at the Australian Catholic University, and very importantly, is a member of the ExMed Cancer Advisory Committee, and it's my real pleasure, and I'm going to invite you up to speak. Thank you.
Good afternoon, ladies and gentlemen. First of all, thank you very much for inviting me to come along today to the launch of ExMed Cancer. It is an honour to be with you. I was invited to say a few words about my own experiences, firstly with prostate cancer and secondly with exercise. I consider myself to be a lucky person. I have survived 2 encounters with cancer. 15 years ago, my doctor thought that I might have a melanoma. The test I had not only proved that my doctor's suspicion was correct, but also that the melanoma was malignant. Fortunately, we got to it in the nick of time. 9 years ago, my doctor said it was about time that I had a prostate cancer test. Up till then, I must admit, the subject of my prostate had never crossed my mind. My very first PSA test indicated that indeed I might have a problem. A follow-up test 6 months later indicated that my situation had probably deteriorated. Soon after, a biopsy confirmed the presence of aggressive prostate cancer. So within a month, I had surgery to have my prostate gland removed. Over the days that followed, as I slowly recovered from the surgery, I waited very anxiously for the results of the pathology. I can tell you I was mightily relieved to be informed that the cancer was almost certainly confined to the prostate gland that had been removed from my body. I'm very happy to report that my PSA tests ever since have been as good as one could wish for. When I was diagnosed with prostate cancer, I was immediately enrolled in a program to undertake pelvic floor exercises. This proved to be beneficial because I had only minor issues with incontinence in the weeks following the surgery. I have never stopped doing pelvic floor exercises, and I will keep doing them until my last days. Now, here's my short history with exercise. I have exercised during most of my adult life, mainly doing a reasonable amount of jogging, as well as playing tennis. But I have to admit that during my working career, I put in very long hours and I didn't take care of myself nearly as well as I should have. I've been retired now for 15 years, and retirement was a big turning point as it gave me more time to do the things that matter. Fortunately, I chose to get back into physical activities on a regular basis. I started playing golf twice a week, and I undertook a moderate program in my modest home gym. Thankfully, it included the regular use of an exercise bike. Over the last 5 years, I have ramped up my exercise regime considerably. Lucky me, I now play golf 3 times a week, even in yesterday's gale. I still have my home gym program, but now it includes exercises for strength, which are more challenging than ever. What's more, I have recently added a good number of stretching exercises in order to improve my flexibility. I also do a resistance training program for 1 hour, twice a week at Keyser. My life is different now, and miles better than it's ever been. And my diet is miles better than it used to be. As for exercise, I am an enthusiastic convert and passionate believer in its benefits. My weekly program amounts to between 15 and 20 hours of exercise. And I think my new lifestyle is wonderful. On a daily basis, I feel more alert and I have much more energy. My mental health has never been better. I also sleep better than ever. And exercise has kept my osteoarthritis at bay. What more could I ask for? Prue, I think you are absolutely right when you say that if one could get all these benefits from a pill, it would be the world's best-selling drug. Before closing, I would like to acknowledge the extraordinary work done by Prue Cormie and her team at ACU in the planning and development of ExMed Cancer. This is a program which deserves every success. So many people in need will benefit substantially from participation. I have no doubt that the Stage 1 program will succeed handsomely and that it will be scaled up to become one of the important remedies for cancer patients in Victoria. Accordingly, let's hope that the government is encouraged to ramp up its very welcome and greatly appreciated financial support. Let's hope also that the community gets right behind the ExMed program. I wish all concerned an exciting journey and every success along the way. Thank you.
I think you've said it all for us, and I think we can go home, shut shop and go. That was really powerful, and I think it's kicked me out of my complacency of thinking I was doing enough exercise. It's now my real pleasure to introduce Nicole Cooper. Nicole describes herself as a wife, a new mum, daughter, sister and friend. In March of this year, Nicole was diagnosed with bowel cancer. She's an ambassador for Bowel Cancer Australia, and again is a consumer representative for exercise oncology at the Australian Catholic University. Nicole is also a member of the ExMed Cancer Advisory Committee, and who I really commend you for having such remarkable people coming to drive and inform your practice. Nicole, thank you.
Good afternoon, everybody, and thank you, Mike, for such a wonderful introduction, and thank you, Prue, for having me here. It is such an honour to be here. My name is Nicole Cooper, and in March of this year, my life did change rather significantly when I was diagnosed with stage 4 bowel cancer that had metastasised to my liver, a lymph node, and my lung. I received a rather dicey prognosis at the time of about 2 years to live. And that was pretty shocking for someone who at the time was 32 years old with a 15-month-old baby. I was in the zone of just coming out of pregnancy, feeling good, about to get active again, and about to pick up life as usual. But life as usual became really quite unusual for someone in my set of circumstances, or so I thought at that time. Not prepared to be dictated to by a statistic, I went in search of a little bit of research around my cancer and ways that I could seek to treat it. I wasn't prepared to live with the 2-year prognosis on my life whatsoever, and went looking for some research that perhaps would allow me to extend my life, or perhaps, dare I say, even kick this cancer to the curb. And I found a few. Mental health certainly was something that I could take some personal control of. Diet was something that I could take some personal control of. And physical activity was something that I could take some personal control of. Now, I need to say that I am not an exercise natural. I was the person in high school who always had a note as to why I should not be running around the track. But I had to challenge that. And in my adult life, I have been challenging that and trying to overcome my fear of exercise and all of the torturous things it would do to me. And as a new mum, I'd been really excited about picking up the exercise and returning to exercise as I'd been working out my entire pregnancy up to the day of my due date. So I went after it. I made exercise mine. Now, as someone who is undergoing quite an intensive chemotherapy regimen, I had to think quite creatively about ways that I could make exercise happen for me. Luckily for me, I had an oncologist who was extremely supportive of exercise as a medicine for me and worked with me to support me and particularly, especially importantly for me, ask me regularly about my exercise as a medicine for me and if I was keeping it up and how I was doing and how it was impacting me. But I did have to think a little bit creatively about how I was going to exercise. I was on a fortnightly chemotherapy regimen. I, as a result of my treatment, developed some rather intense side effects, some peripheral neuropathy, some pretty extreme sensitivity to environmental factors, particularly cold. I had sensitivity in my hands that's grown and changed over time, which means I've had to change the way that I work out and the way that I move. But basically, I kicked off my exercise with some short, punchy workouts in the park and escalated that over time to nowadays when I complete 2 to 3 RPM classes a week, and every other day I'm in the gym lifting some pretty heavy weights for someone who wasn't really into weightlifting. Now, that's something that I've had to change and had to address and had to manage as a person who's very active in their cancer journey and cancer treatment, but it's something that I feel has truly made a wonderful difference to my outlook at the very least, even before we start to consider all of the miraculous and wonderful impacts that exercise can have on somebody's cancer. But I want to also not acknowledge the role that the medical fraternity can play in making patients feel like they are empowered to choose exercise. I've spoken to a lot of people in my cancer journey, which only kicked off in March of this year, who've pushed back on exercise significantly and said, I'm a cancer patient, I'm sick, I can't get off the couch, my treatment is so painful, my side effects are so nasty, there's no way I could ever do this, and even if I wanted to, I don't think my medical team would support it. They certainly have never spoken about it. And I'd like to say very loudly that we need to have more conversations about exercise as a treatment, because there's an opportunity to embed it in our understanding of exercise, in our understanding, of cancer treatments more broadly. But without that permission to exercise and without that regular follow-up, it would have been difficult for me at times to believe that it was the right thing to do, because it is tough to have cancer, and it's even tougher to have cancer treatments. But we need to make decisions for our health, and we need to feel like we're supported in making them. No one's ever questioned my chemo regime and whether it was really the right thing for me to be doing. Plenty of people have questioned the exercise. My medical team have given me permission to challenge my diagnosis, to choose the impossible, and to dare to believe that perhaps I could do something personally to challenge my diagnosis. Now, when I was diagnosed with my 2 years to live in March of this year, I was told at the time that was because I had an inoperable metastatic cancer that had basically taken over my liver, and there was no way that we were going to ever be able to be in a position where surgery was possible for me. But my impossible surgery has been scheduled for tomorrow. And when people talk to me about if I'm scared or if I'm nervous or if I'm worried about my surgery, the answer I give them, and this is 100% serious, is that I'm only worried about how quickly I'll be able to get back in the gym. Because that is my part of my cancer journey that I can own, that I can drive forward. And who knows why it is that I'm in this position where my treatments have worked. Who knows why I've been able to take my rather nasty prognosis of life and turn it around and make it work in my favour. But I've certainly used every tool that was in my tool belt, and exercise was really a very important one. In closing, I just want to say that I think that this program in particular is so incredibly important because it puts exercise out in the community and it makes it accessible to people. The referral-based program is so, so important. And I think the future of this program is very bright, and I could not be more thrilled to be playing a role in that and have a part of that. And in closing, I'd just like to say that exercise is my medicine for cancer, and it's certainly working for me. Thank you.
Nicole, thank you so much for that incredibly powerful and articulate presentation. And I'm sure I speak for everybody in this room when I say we'll be thinking of you tomorrow. I'm looking forward to hearing a true gym junkie where you'll be back in the gym as quickly as possible. Thank you for sharing that with us. Our final speaker before we have our panel conversation is Dr. Prue Cormie. Dr. Cormie is a medical oncologist who has a subspecialist interest in gastrointestinal cancer. He works at Eastern Health with Eastern and Yarra Oncology. He's involved in a lot of clinical research, but perhaps most importantly in today's context, he is now a converted cyclist. We have many of those in the room, I think, but with that conversion has come a real belief and a recommendation to his patients about the importance of exercise.
Good afternoon, and thank you for that introduction. And I'm really pleased and privileged to be here at the launch of this exciting program. And I'm also privileged to be Nicole's medical oncologist. And yeah, what Nicole and Vin shared today is very, very powerful messages, and really supports what Prue is trying to establish and achieve. And I can attest to that as an oncologist in the community. I see this playing out every day, and Nicole is a fantastic example for that. So nowadays, exercise is a vital part of our conversation. When I see someone, whether they need treatment or they need follow-up or surveillance as a survivor, as an ongoing thing down the track, exercise is such a vital part of their oncology journey. And as a survivor, like was mentioned earlier, as a lifestyle thing. So when I started, at the moment, when I see someone exercise as a prescriptive aspect, what exercise do you do in combination with what chemotherapy you're going to have? And I make refer to an exercise physiologist. So day one or cycle one, when they start treatment, there's an exercise program supervised by an exercise physiologist that goes with the chemotherapy program. Or any other treatment program they're going to have. But that wasn't the case just even 10 years ago, 15 years ago when I started training. We would prescribe chemotherapy, we would be seeing patients in the clinic, and invariably chemotherapy takes a big toll on someone's body. And so fatigue is a major complaint. Like Prue mentioned in that slide, there's so many components of that. Neuropathy, tingling, numbness in the fingers that goes with some chemotherapy drugs is a big problem, builds up as a cumulative effect of chemotherapy. Cognitive decline, chemo brain, you know, it's a serious thing. People can't concentrate, people can't remember things, and it builds up as chemotherapy progresses. Functional decline, they can't get out of the chair without actually needing support by themselves or someone else. So all these aspects are unfortunately part of chemotherapy and cancer treatment. And so we used to advise people to, if you're tired, if you've got problems with treatment, just rest up. So rest up on day 1 of chemotherapy, cycle 2 comes around, they're more fatigued. We say rest up for 2 days, rest up for 3 days. In the end, people are resting all their time and they're becoming more dependent on others. And what we found was then we have to do dose reductions of the treatment. So you think, okay, well, they're resting as much as they can, this is not working. We reduce the treatment dosage, see what happens. You reduce the treatment dosage, still, well, the treatment's not going to be effective as much as it would have been. But we're feeding a vicious cycle, and in the end, you actually stop treatment prematurely. And again, people are not benefiting from the potential benefit they would have got if they received the full treatment. So we were feeding a vicious cycle, and in effect, people are not getting the treatment that they should receive, and they're not maintaining their body in an optimal condition to receive treatment. And we're still only scratching the surface here at the moment, but we know cancer and the cancer treatment is an interplay between the cancer itself, which then the person's body, very unique. Cancer itself is very unique. It's got its own molecular mutations, very unique. Even 2 different melanomas would be completely different genomically. The person's body, their approach to treatment, their psychological status, that's all very unique. Then there's the immune system on one side, which helps control the cancer in combination with the treatment. And the 4th aspect of it is actually the cancer treatment itself, which is variable. It could be chemotherapy, it could be immunotherapy, targeted therapies, etc. So this interplay, exercise feeds into all aspects of that interplay, which is the fascinating thing. So exercise, again, like I think people like Prue's research is what's bringing this up, but we're still pretty much scratching the surface in terms of how exercise enhances someone's immune system. That could have a big impact on how the treatment's going to work. How exercise improves the chemotherapy or the treatment delivery into the tumors by perhaps enhancing the blood flow to the tumors, and how exercise itself can modify and modulate the behavior of the cancer itself by perhaps various growth factors that get generated in the process of muscle breakdown and regeneration. We're still just learning about this, but what I can say as an oncologist is it works. It really does work. So I'm seeing people with less cognitive decline, they're more engaged, they're more active, and they enjoy a better quality of life. Particular symptoms like neuropathy is much less, and as a result, for example, Nicole was able to finish her proposed treatment in time without treatment delays and in full doses. Now that would have been a rare occurrence a few years ago when exercise wasn't a big part of this treatment program. So I've seen this firsthand, and that's motivated me to speak out about this more and more. And in particular types of cancers, for example, breast cancer and prostate cancer. So breast cancer people are often on endocrine therapies, which predisposes them to osteoporosis. In addition to everything else exercise does, has a huge impact on maintaining bone density. Prostate cancer is an environment where a lot of people with stage 4 prostate cancer, they're on testosterone-lowering therapies, and as a result, there are many implications, including metabolic syndrome, hypertension, diabetes, cardiovascular disease, and again, exercises can reverse a lot of that. So for every cancer, I think exercise has a huge role to play. Particular types of cancers, there's increasing evidence that exercise has the potential to reverse some of the treatment effects. So in my personal experience, I've embraced this, and I think going forward, programs like this, getting the message out into the community, patients education as well as the physician education, I think is a key part, and this is a great start, and I'm privileged to be part of it. Thank you.
If I could just ask our 4 speakers to just come and sit at the panel. My apologies to the people online that you won't be able to see people, but I hope you can hear them. We are running out of time, but the joy of giving a Celtic girl the floor is that I can control and manipulate things, which I'm going to do. So with your permission, we may go 5 minutes over, but I think it's far too good an opportunity to miss and not give people the opportunity to ask some questions. So I'm going to open the floor to questions. If anybody would like to start, gentlemen there.
Three days ago, I returned from China, from the World Dragon Boat Championships. Our team of over 60 age group competitors won 3 silver medals and 3 bronze medals. A number of members in the team were recovering from breast cancer, and in particular, our drummer was given permission to halt her chemotherapy from pancreatic cancer to participate in the sport. I would like to recommend that dragon boat racing, which is a little-known sport, please be aware that it's no longer a little-known sport, is a marvelous sport for not only for participation, but for the mental effects of having a number of people around you with similar circumstances. It's a marvellous exercise sport available for all. Thank you very much.
Thank you very much. That's good, of course. Anything with a dragon in goes very, very well. So, gentlemen at the back.
A bit more indulgence. I was diagnosed with stage 4 prostate cancer almost 4 years ago. And I discovered the joys of road cycling. I suggest everyone buys a road bike. So this year I'll be cycling about 15,000 kilometres or more. On Wednesday I'm going to do a 300-kilometre ride, I hope. So my question is there any opinions / evidence even about the more extreme ends of exercise, so the people who are total gym junkies or total cycling junkies or dragon boat junkies? Is there any data on that, or is the sort of scientific advice, well, maybe they're overdoing it?
Good question, thank you.
Well, congratulations on the ride, hopefully all goes well. So we know from scientific evidence that any exercise is going to be a very effective medicine for you. We don't really know a lot about how much exercise is too much, and if there is a point where it becomes too excessive. Certainly we know that the most benefit from doing exercise happens early on, when you perhaps do nothing whatsoever and you start to exercise, and you exercise very effectively. That's where you get the biggest benefit. And then it kind of tapers off a little bit. So we don't know if somebody who's doing too much exercise, if that starts to come down and becomes something that's an adverse effect. What we know from a wealth of scientific research is that exercise is safe for people both during and after cancer treatments. And we really haven't had any scientific literature to suggest that there should be any point where you say stop and that's too much. In a program like ExMed Cancer, it's really important to have qualified professionals to work with you, because we think a lot of the time that you need to whip people to do exercise, but sometimes we actually have to pull the reins back and slow them down a little bit. And that's just to make sure that they don't exacerbate any of the symptoms. So seeing a professional means that you never get to the point that you will have too much exercise, or that exercise will cause any issues for you.
Yes, thank you.
I was just wondering, what is it about the exercise, and in particular the type of exercise that you're advocating, that does have this beneficial effect? What is the actual nature of its impact on the system, and can you envisage a time when that can be simulated in some other way where perhaps you have patients who can't participate in it?
Well, thank you. Just giving me permission to talk for the next hour. It's a really good question, and there's a lot of stuff that we don't know about exercise specifically for cancer. We generate a lot of data about what happens in animal studies, what happens to mice when we exercise them, and we can dissect and see what happens to the actual tumour and things like that. And early evidence from human trials to understand exactly what are the mechanisms or what are the factors that drive those changes. But the hard part of it is that exercise is a very powerful medicine in the sense that it impacts the structure and function of virtually all the body systems simultaneously. There's really no other medication or therapy that can positively influence as many body systems as exercise can. Now that gives us a really good result, but it also makes it very hard to understand exactly what's going on and to pinpoint exactly what's going on. So there's a lot of things that could be impacting this. The ability of exercise to enhance our own immune system so that you're kind of supercharging your immune system to help fight off the cancer. The ability to really, as Sarah mentioned, change the way that bloods get into the cancer cells, and the cancer cells change the way that our bodies kind of send nutrients and things to the cells. So exercise may normalise that, get rid of some roadblocks, and help the chemotherapy and other agents kind of get into that tumour and suppress its growth. It changes our hormones in a positive way, so it suppresses some of the factors that accelerate the growth of cancer. And then there's a whole range of factors in the way that we can actually use exercise to counteract things like fatigue, functional declines, psychological distress, and so on. I better stop there, otherwise I'll keep talking for a long time.
She's not wrong. But I think it's a perfect example of why Prue's doing this. We'll take one question on the floor, then there's a couple online, and I'd like to give the last word to Vin and probably before we finish.
Yes, given that you stated the statistics earlier that 50% of us in this room will likely be experiencing cancer of some sort, what role do you see that exercise having as a preventative for us today, starting today, for 50% or for all of us in the room? How might we affect the future of our personal health today?
Great question. And it's really the smartest health insurance policy you can invest in, exercise. We know that exercise prevents and reduces the risk of developing a number of different cancers. So if you can go and see a professional, invest the time and the money and the small amount of money it takes to actually start to engage in exercise and do high quality exercise. It's probably the smartest thing that you can do to minimise your risk of developing cancer and also to minimise the risk of dying from any disease prematurely.
Thank you. Nicole, can you want to
just to add to that, as an oncologist, something I see, and I think that's a problem with our this day and age, and the awareness of metabolism, nutrition, and exercise, diet, etc. Fatty liver, I think that's our next epidemic that's coming up. Fatty liver disease goes with the other problems that goes with it, like hypertension, diabetes, high cholesterol, increased cardiovascular risk, and mortality. And I'm seeing increasing patients who have no liver problems, and they have developed liver cancer, cholangiocarcinoma, primary bile duct cancer, no other risk factors except there's some past history of, my GP said I've got fatty liver, I've had it for 10 years. Slight abnormalities in liver function, you don't know that you've got it. So I think that is one of the obvious things that for me, exercise will reverse that. And that's just one thing. It's a good question. It's associated with increased body mass index and weight. So there's a correlation between that and reducing body mass index and increasing exercise to get the liver function back down normal. That's my experience. But there's a lot unknown. It's part of the syndrome, the metabolic syndrome.
Thank you. Did you want to say anything? How did you get going?
Just a brief comment. I don't believe my prostate cancer was related to genetics. There was no prostate cancer in my family. I think it was environmental, my diet, lack of exercise. Australia and New Zealand have the highest rates of prostate cancer in the world. The lowest rates are in Asia. There are differences. It's not just diet, it's also environmental, they deal with stress and so on. But exercise is a great protective factor.
Thank you. I just want to pick up, there's a question online for the people attending via the webinar where they have access to the resources in the lobby. What's the best way? Could they go online and contact the Hub?
Absolutely. Just contact us through the Hub, have a look at the ExMed Cancer website, and you can shoot us an email or ask us a question right through the website.
Great, thank you. And then the important question really, what are the exclusion criteria to ExMed Cancer? So who can't take part?
So
we know we've got that year on because of the 200 patients and the money is fixed.
Absolutely. Look, I would encourage anybody with an interest in getting involved with exercise to contact us. Because even if you're not eligible for ExMed Cancer, we can provide services that will give you better care than you would if you didn't contact us. So we can refer you on to other services. There's some key exclusion criteria, one being that unfortunately we can only take English-speaking people, because we're doing a research evaluation on this. And then we're also making sure that you don't have any unstable health issues that preclude you from being involved in a group-based exercise program. So other than that, it's really anybody can give us a call or shoot us an email. We can try and help them as much as we can.
Okay, and just one last thing, really important question. Are there any future plans for similar exercise models for people who are inpatients?
Absolutely. So ExMed Cancer the model is developed based on the fact that we want to get everybody involved with exercise medicine throughout the entire cancer trajectory. So when you're first diagnosed, before you have treatments, during treatments, and after treatments. So we're very focused on trying to expand and scale ExMed Cancer so that we can have ExMed Cancer at Peter Mac or at Olivia Newton-John Cancer and Wellness Centre or at Western Health. And this is something that we really need the support of government and hospitals and funders to make happen.
I am aware of the time. I am aware that we could stay all afternoon, I'm sure, and have the conversation, but I just would like to give everybody in the panel, perhaps Prue, you can go last, one more opportunity to say something before we finish up, and then I'll ask you to jump at a fantastic bit. So we might start at the end of the year. Is there something else you'd like to add in closing the session?
Yeah, I think my key thing is to educate as many people as I come across, and I think and that's the most powerful message we can give, and educating not just well, everyone in the oncology community really. They're hard conversations to have. It's asking someone every time you see them, how's the exercise program going, and recommending exercise is not easy. It's an added step to your conversation and can take you anywhere. And you often talk to people who never exercised in their life, really, in a serious sense. And so it can be a challenge. And educating physicians, oncologists, oncology nurses, Cancer Day Center, great opportunity. Oncology nurses spend ages with the patient while they're having treatment. So next step would be broadening this to target the other key players.
Thank you.
Thank you. I guess just building on what Prue said in the opening of her address and the question that came from an audience member around the prevalence of cancer and the rates of cancer, that even as much as half of this room is going to experience cancer, that cancer can strike at any moment without any indication that it might be hiding. And I think that if we take a proactive step to realising that we could actually just be sitting in our chair right now with cancer, we could start that treatment today. And not only is it a treatment for cancer, it's a treatment for so many other things in life with really positive outcomes. So that would be my point. Thank you. Thank you.
Apparently the worst thing we can do is to sit around and do nothing. And I'm aware that many people don't like exercise. Look, it can be hard, but one of the key messages is that the exercise can be moderate. You can set your own level, and if you are inclined, you can step up. You will certainly feel the benefits. So, once again, I encourage you. Great diet, great exercise.
Thank you.
And I'd love to finish just by acknowledging the amazing group of people who've been involved in the establishment of ExMed Cancer. We have an incredible project management team, an amazing steering committee, the input and expertise of an incredible advisory committee, And without all these people, we couldn't develop ExMed Cancer. And I really think that ExMed Cancer and exercise medicine in general has the potential to change the way we treat cancer, to be a paradigm shift in clinical care and to significantly improve people's lives. So I hope that you will join me in thanking everybody who's been involved, and certainly formally my great pleasure to officially open ExMed Cancer for business.
Thank you very much. Thank you for allowing us to run over, and we wish you very well.